Hi, my name is Hunter, and today I will be performing the skill drawing up insulin, and we'll go ahead and get started. So I've got my school badge, I'm wearing my scrubs, I don't have any nail polish, and then no jewelry. So the first thing that we want to do, well, I guess I could talk about what I have. So I've got my regular, my NPH, my gloves, my insulin with the needle, and then I've got my alcohol prep pads, and then my patient. So before we get started, we always want to make sure when administering any medication that we, one, verify the prescriber's orders. So we'll go ahead and do that. Okay, verified that. And then we also want to make sure that we verify the 6 rights of medication. So being right patient, right drug, right dose, right route, right time, and then right documentation. After that, we want to check the medication to the EHR. So then we would go ahead and do that. Okay. And in doing this, we want to make sure that the dosage is right. So we'll go ahead and discuss the appropriate dosage for the insulins here. So we always want to do regular to NPH. So for this, we're going to do 4 units of regular, and then we're going to do 8 units of NPH, which is a total of 12 units of insulin. Okay, so discuss that. After that, we would then go into the patient's room, knock on the patient's door, shut the door behind us to ensure patient privacy, introduce myself to the patient. Hi, Mrs. Smith, I'm Hunter. I'll be your nurse today. In doing this, we always want to perform our hand hygiene simultaneously and then identify the patient using 2 identifiers. Mrs. Smith, can you go ahead and state your first and last name and your date of birth, and then we would be verifying their armband as well. Okay, the patient has been verified using 2 identifiers. So then we would ask the patient if they have any allergies. Mrs. Smith, do you have any allergies? No? Okay, great. So then I would perform my hand hygiene. Okay, put my gloves on. I would also want to ask the patient, I would want to know what the patient's current blood glucose level is, and when their next meal is going to be. That's imperative as administering insulin. So we will go ahead and discuss with the patient like why we're here, talk about the insulins, we will talk about the purpose, the mechanism, and then the use of them. So we will start with discussing regular insulin. So regular insulin is a short-acting insulin, and it is going to draw glucose from the blood into the cells, and it will use it up as energy in order to lower glucose levels. And the side effects for that one are going to be increased hunger, some shakiness and or anxiety, and then we would discuss with the patient about any adverse effects, explain adverse effects are the ones that we don't want to happen. So adverse effects of that are going to be seizures, increased heart rate, tachycardia. So if you experience any of those, please let us know as soon as possible so we can address it and notify the healthcare provider. NPH is going to be the intermediate insulin, and the same mechanism for that one is going to help with lowering those blood glucose levels. That is going to be significantly longer acting, about half a day. I do want to mention regular insulin the use of it is going to be 30 to 60 minutes, whereas NPH is going to be half a day. It's going to be significantly longer. So let me bounce back to NPH. Sorry, I'm kind of all over the place. NPH is going to be the same as the regular in terms of, let me back up. Side effects of NPH are going to be weight gain, and then sweating. Adverse effects, again, we don't necessarily want these to happen, and if they are to occur, let us know as soon as possible. They're going to be similar to the regular insulin, but in addition, headaches and any confusion. So if you experience any of those, please let us know as soon as possible. Okay, So after that, we would then get another nurse in to the room to help us with that verification process of administering insulin. So we are going to select the order of insulin, which I think I already mentioned in the beginning. We're going to go regular to NPH, and as we do this, we want to verify each draw of air and medication to the EHR and with our second nurse. So moving forward, what we want to do is we want to go ahead and alcohol prep the tops of the bottles here. Okay. Okay. And again, we would want to verify these to the EHR and make sure we have the appropriate dosage again. So before we move into drawing them up, we want to, in addition to that, we want to roll the vials. Okay. And I apologize, I actually had this step backwards. So we would calculate the volume of insulin that we're going to be administering. We would ask the other registered nurse to help us with that verification process, and then we would go ahead and then we would wipe the tops, or sorry, we would verify and then we would roll. So verify with another nurse, and then we would roll, and then we would alcohol wipe the tops of these. So I did it a little bit backwards, but yeah, that's the steps that we would want to take. Okay, put this here. So I'm not going to redo that because I already did that, and then I kind of just explained it to you, and hopefully that's okay. So we're going to go ahead and start by taking our insulin syringe, and we're going to start by administering 8 units of air into our NPH insulin, and that's the order we're going to do it. We're going to go NPH, air, into NPH, and then we're going to do air, 4 units, so 8 units of NPH air into NPH, and then we are going to verify that, and then we are going to do 8 units into, or sorry, 4 units of regular, 4 units of air into regular insulin, and we're going to invert, and then we are going to draw from the NPH and verify it again. As we do this, I'll explain as I go through. So first, with the cap on, we are going to go to the 8 unit marker. Okay, and then I'm going to remove the cap, and I'm going to insert this needle into the intermediate acting insulin. And as I do this, I want to make sure that I don't touch any of the medication or pull any of the NPH out. Okay, make sure you can see. So this is NPH, so we're going to start here. Okay, okay, we're going to insert 8. I did want to say, as I draw the air back, I would verify that air draw with the other nurse. Okay, so we've done that. Now we're going to back draw 4. Okay, we verified it with the nurse and the EHR. Okay, then we're going to inject it into the regular. Back here so you can see. Okay, and then we're going to invert, and we are going to draw 4 units of the regular insulin. Okay. Okay. Right, and then we would gently tap if necessary, and then slowly or gently press on the plunger if needed. This doesn't actually have any air bubbles in it, it's beautiful. and then we would again verify it with the other nurse in the EHR, and then we would want to draw our NPH next. So as we draw the NPH, we want to make sure that we don't let any of the regular insulin go back into the NPH, but we also don't want to overdraw. And so what we're going to do is we're going to know exactly where we're going to pull the 8 from. We're going to know exactly where the 12 marker is and where we're going to stop. So we would, again, verify this dosage before we pull it. So we're going to go into the NPH. Okay. And we want it to be a total of 12. Okay. All right. So we've got 12 total units of insulin. We've got 4 of regular and then 8 of NP. And so we would again verify it with the nurse and then to the EHR as well. And then after this, we want to go ahead and we can do a scoop to put a cap back on the syringe. Okay. All right. Okay. And then since we have already verified the combined dose against the MAR, we would want to do it again. After that, we will go ahead and administer this, but we'd also want to note that if the medication was to be drawn away from the bedside, if the medication was to be drawn away from the bedside, we would want to put a label on it with the patient's name and then the dosage as well. I think I got it all. Yes. Yeah, that's it.